We'll come back to the cover sheet and review these buttons in the top right on the cover sheet. So we have PDMP query, which I won't select, but this will walk you through doing the prescription drug monitoring program search function for patients who are for whom you need to review their controlled substance use. JLV, we won't review here, but this is a mechanism to review data from other VA sites, remote data. If you have patients who are seen in other non-VA hospitals, select this. So this patient is seen in Loma Linda, it says, and the Orlando VA. So you could check off or just check off all available sites. If you do this before opening JLV, then it will populate information in from those other locations as well, in addition to only VA locations. We'll close this. Postings, again, is this area. Importantly, I wanted to point out our life-sustaining treatment notes. So for patients where their code status is being entered, we need to enter it as something called a life-sustaining treatment note. So obviously that's under the notes section, but once that is in and signed, that shows up here, sorry, to make it very easy to review when you immediately open the patient's chart. So if we select life-sustaining treatment, we have immediate access. We know what this patient's goals of care are. This patient is DNR, any other things. When you enter that note, there's a list of options, ICU options in terms of pressors, intubation, et cetera. Do they even want to be upgraded to the ICU? Do they want antibiotics? All of those things. When you enter the note, you can enter those things if they're relevant. If not, they're not mandatory, so you are able to skip them. But this has been standardized across the VA. So any VA you work at will have these life-sustaining treatment notes. So make sure you're checking with your patients about their goals of care if they're relevant to their hospitalization, and making sure these notes are being entered so that it can facilitate appropriate care for these patients. When you do enter the notes, it will automatically create an order for their code status. So if you have a DNR, for example, this is the mechanism for entering the DNR order in our system. And again, that's just under the Notes tab, which we can open up here. Unfortunately, it takes a minute for this patient to load for some reason. But if we said new note, created a visit for this patient quickly, then life-sustaining treatment note, it pulls up that template, and we could walk through it. Anyway, I won't walk through all of this now. You get the idea. We'll say cancel. It's going to ask us if we want to cancel. We'll say yes. We can delete that. But that is the postings and the life-sustaining treatment note.